Well, hello everyone. I'm Colonel Philip Blair, MD from Blair Medical Group, and I'm here to talk with Nique. She is a user of beta-caryophyllene, and I'd like to have her tell you a little bit about herself and to explain how she's been using beta-caryophyllene to help her with her conditions that she has. Nique, it's a pleasure to have you on board. Give us a summary of who you are and what you've been doing.
Thank you, Dr. Blair. Well, I am a two-time breast cancer survivor. I'm a nurse. July will be for 30 years and a veteran of the United States Marine Corps. But through all that, I've struggled for ever since my teenage years with depression and anxiety, and through my younger adult life with an eating disorder.
So, how did you learn about beta-caryophyllene?
So I actually met you at Patients Out of Time. I was attending a booth and you had offered a sample of your product for me to try.
And then, so did you start using it at that time?
I did not. It sort of did a little bit of something to me, I thought, but then I'm like, oh, am I just like overthinking this? I tried it a couple times, and like anything else, I start something a little bit and then I'm like, yeah, that's not going to work.
But then you started using it seriously at some point.
I started taking the BC Plus immunity capsules. I started having peace. My anxiety and my emotional reactivity and the way that I looked at and handled situations seemed to be easier. But then last year, as you know, I had like a major surgery for my breast cancer. My surgeon wanted me to come off of the BCP. I did find a difference in my mental health, which was also compounded by this major surgery. So it was hard to understand and figure out, was this the BCP? Was this my surgery? Is it a little bit of all of it?
So I have the impression that you started on the BCP, you noticed some specific benefits, you may have noticed some benefits, but then you got off of it and you may have deteriorated in some way, and then you were trying to figure out what it was that caused the deterioration.
It was really hard to figure out, especially when I was trying to get back on my feet. I believe I did because of my depression. I believe I did go back on the BCP because I needed to know for myself if was the BCP actually helping me that much. Sure enough, it helped me get back into a healthier state of mind. Some of my motivation came back. The depression, even I struggle with thoughts of suicidality, even with some of my issues with the loss of motivation, this whole new body transformation, the complications, menopausal issues. I really find a huge benefit in my mental health. And the only thing I take is BCP. The only other medication that I use is my inhalers.
So
It's
which form of BCP are you using? Using the metabolic blend of the capsules?
I started with immunity, then I did the trial with you with the metabolic, and now I actually do BCP immunity and BCP metabolic. I do one of each twice a day.
You notice these specific benefits over time. I've noticed in particular that it seems to have transformed your motivation and your particular task orientation. I've seen you become more productive and more outgoing and more social as well. Is that a misperception on my part?
I don't think so. I have been able to structure my thoughts and to feel, when you feel better about yourself from the inside, it shows on the outside. So I think having a more calm base as my foundation now, it kind of sends a different aura about me. Perhaps others are seeing. And I can only say I work with Dr. Perlson at the research center, but he's not in person a lot, and our schedules are very different. A couple of weeks ago, I saw him in the lunchroom, and he said, Nique, you have a different type of confidence about you now. I don't know what it is. And I said, I do. It's got to be the BCP. And we chuckled to have somebody like that recognize it, being a neuropsychiatrist and all the work that he does. I didn't do anything different. I didn't say anything different. And he was able to pick this up. I used to be afraid to talk to him. I was so anxious to be in a conversation with Dr. Perlson. I felt very intimidated. I didn't feel that I was smart enough to be in the room. It was such a nice interaction to be able to talk with him, just brief day conversation. It wasn't anything major, just how are you today and how have you been doing? To be able to have that ease of I'm worthy. And that's what I believe he picked up on.
I mean, that's tremendous. It relieves your anxiety. It relieves your depression, I assume. It puts you on a motivational track to get things done, to take care of business, and to mobilize yourself in a very active way. It's very, very impressive. So, do you think it's changed your life in any way?
Absolutely. 150%. Like when I run out, I get like all panicky, like, oh my gosh, I got to get my BCP. I really feel it's life changing. And again, I don't even know how or why. I can't really say that I even expected that this was going to happen because I really didn't think it was going to be honest with you, Dr. Blair. And I I can't believe how it changed my life. I mean, I've been through ECT, I've been through pharmaceuticals, I've struggled in many areas of my mental health. I'm just very blessed that this has been beneficial for me. Now, don't get me wrong, I've worked very hard on other tools. You know, we have to work on our thoughts and our
Sure.
perception and our mind. And you can't just take a pill, whether it's a pharmaceutical or, plant medicine based, and just not do the work. But I think this has given me the foundation also to be able to do the work. Where I did start this journey with cannabis, as you know, but I am so sensitive to THC that even in microdoses, and I'm talking even 2 milligrams, if I do even just 2 milligrams of THC a day, over a few days, I have to stop and rest, and then I can start taking it in. It makes me paranoid. It increases my anxiety. It's to the point where, unfortunately, I can't use cannabis anymore because, for whatever reason, and I don't know why, I'm very, very sensitive to THC.
So one of the things that you pointed out is that it motivated you for nutrition. It has motivated you for exercise. It's motivated you for your social skills as well. And it's also motivated you in terms of your passion for the projects that you have in board. It has accelerated these phenomena in your behavioral life and in your nutritional life. I see it as a benefit and a encouragement of these factors, not being BCP alone, but how it modulates these other systems so that you can achieve the greatness that you deserve.
I believe so. I really do, because and I'll say it again, I haven't done anything else besides BCP. And last summer, when I had to take it away, I think you recall, Dr. Blair, I reached out to you and said, I'm trying to figure this out because the thoughts, the thought patterns, my feelings, even sometimes paranoia, just generalized, they don't like me, and different thoughts that go through my mind. I'm I'm just so grateful for this product because it's the first time in my life I feel peace. And that is, it's scary at first because you wait for the other shoe to drop. But then when you start to feel this peace, it's okay to be me. And for me, that is why I am just a huge advocate for BCP.
And would you recommend it for others?
I have everybody I meet and see, if they're struggling with pain, I have um, invited others who have pain issues to at least try it. And I also encourage others that are struggling with anxiety, some mental health issues, that at least give it a shot. It doesn't hurt, and you can use it with any of the medications that you're on. So you don't have to stop anything else that you're doing. Just try it, see if it works.
That's fabulous, Nique. It's been such a pleasure talking with you. This is such a valuable testimonial to the benefits of beta-caryophyllene, and I hope more people will ascribe to it and consider using it and giving it a try to correct for their pain, their anxiety, their depression, or really whatever inflammatory issues that they may come upon. So thank you again. Thank you very much for speaking with us today.
Thank you so much, Dr. Blair. I'm very grateful for you and your product.